do a very few minutes of illuminating the impact that behavioral has on our Accountable Care Collaborative. We are next going to move to kind of like a how to integrate behavioral health, sort of an A to Z steps. And then we're going to move into the testimonials from the practices. Tonight we're featuring Mental Health Center of Denver, MHCD, and Rocky Mountain Youth as a very long relationship of integrated mental health into their physical practice. And then we're going to look to Bruner Family Medicine Residency as an up-and-coming practice that's integrating with the mental health clinic. At the very end, we're going to look for perspectives from you all. Some of you already have integrated behavioral health into your clinics, and we want to hear best practices. Your handout has some upcoming dates. I'm not going to go over all of these. Please look at them, take them back to your organizations, let other people at your organizations know when these 3 meetings are happening so that they can put them on their calendars ahead of time. And I do want to let you know that we are videotaping this. Why are we videotaping this? Because it goes onto our website. A website that all of you can access, that you can go back through, that you can look at the steps on what it takes to integrate behavioral health. You can hear from those pediatricians and those mental health providers where the system has worked for them, where it's worked for their patients. And this is how you get onto the website. So circle that, put it on your favorites. Not only will you be able to get videos of tonight's presentations, you can download the presentations and you can blog back and forth. You'll also see that since we've been doing this virtual community for collaborative care website, we have 2 other best practices meetings and all of their videotapes on the website. So the first couple of slides you have, for those of you who are in the room at the beginning of our best practices and clinical transformation group, these are how we rolled up our sleeves, we got in the room, we covered the walls with paper, and we came up with kind of a charter as to how we are agreeing to work with each other, sort of some of the rules of the road to speak of. And they will be in the front of every best practices and clinical transformation meeting. I urge you to look through them because they're lofty mission, vision, values, and goals and strategies, and yet this is how our work will be accomplished. The tenets of engagement are things that everybody came up with throughout all of our RICOs. And now we'll get right into the integrating of behavioral health, today's topic. And the 2 bullets I want to point out is the reason we're doing this is that mental health conditions result in disproportionate bad outcomes in physical health. And that's all the way from depression, resulting in degraded self-efficacy and diabetes. All providers know that. Schizophrenia complicating medical conditions like COPD, peripheral vascular disease, HIV infection, and even malignancies. And so the SDAC can break out these conditions for us, and we can see just where mental health lies amongst some of the other medical conditions that so often we hear about initiatives being done in the community. This is for Region 3, and here we have the number of claims that are being reported, and here we have the conditions as described by SDAC. You'll see that mental health is number 4 after other, and I'll explain what that is. It's in your handout. Asthma, hypertension, and an other M1. This is where substance abuse disorders come in and other sensitive types of codes that we mask, basically. In the state of Colorado, those are masked. But you'll see that mental health and substance abuse disorders as conditions in our population are way above obesity, epilepsy, back pain, coronary artery disease, osteoporosis, gastrointestinal diseases, and stroke. And think of all the initiatives we have going on about those diseases in the community and how little mental health and substance abuse get the deserved attention. A similar one for Region 5, slightly different. Asthma still leads the top. Here, substance abuse is reversed with mental health as being more prevalent in the claims than the mental health is. So let's look at those conditions real quickly. These are the diagnoses, the actual codes that are going into the mental health bucket. So these are the codes that will be in there. In the M1, the other M1, or the M1, and a lot of people have always wondered what that is, these are the codes that go in. These are the sensitive codes. Anything that's alcohol services, training, screening, assessment, prevention, hotline, housing, abuse services, intervention, outreach, screening, alcohol drug services, treatment programs, any of those, all the way down to assaying for specific compounds that lead to substance abuse. Education, all kinds of things. These are all masked from the conditions that you look at in SDAC, and yet they are all rolled in to the clinical risk group score of each and every patient. So the patient's clinical risk score will have all of their diagnoses in it, and yet when you try to link a substance abuse or a sensitive disorder with a particular individual, these are ones that are masked and will be under M1. And some states do that, and Colorado is one of those. So the last slide is just sort of the distribution of these other medical ones. So there's other M1, which is substance abuse primarily, and other medical. And all of these disorders basically are a complexity of medical codes where it's not recognized on the claim that there's one driver. It's not recognized that there's one chronic condition driving the claim. And some of the things that are on here that are in the bulk of this region here, you'll have hepatic and renal disorders. So they fall out of the other gastrointestinal codes. You'll have two or more significant illnesses. You'll have neuromuscular and other neurological conditions, malignancies with other medical diseases, malignancies in a cardiac patient or malignancies in a COPD patient, developmental disorders, skin diseases. A lot of those come in the medical other. So that's how you read your graphs of Region 3 and Region 5. The reason I'm presenting them is to show where mental health and substance abuse disorder are on the claims, and they're extremely high. No more said. We have to look at how we integrate these two together to get the care that our patients need and deserve.